Good morning, class.
Good morning, Mr. Forna. How are you doing today?
I'm fine, thank you, Arbanisha. And you?
I'm doing great.
Good. Today we are going to talk on a topic called first aid. But before we start, who can tell me what first aid is?
Yes, Mr. Forna.
Okay, go ahead.
First aid is the first treatment given to an ill person before taken to the hospital.
Good try. Any other definition? Okay, now take down this definition. First aid is the first and immediate assistance given to a casualty, or any person with either a minor or serious illness or injury before the arrival of a doctor, or taken to the hospital. Is that clear?
Yes, Mr. Forna.
Now we are going to talk about why we give first aid.
Yes, Mr. Forna, I was just about to ask why we give first aid.
Alright, now just listen carefully. We give first aid for the following reasons: to preserve life, to prevent injury from getting worse, to aid recovery, to relieve pain, to protect the unconscious, etc.
Wow. That's wonderful.
The next topic that we are going to discuss today is the steps of first aid. A summary of the steps of first aid are as follows. 1. Check for danger. Before approaching the casualty, always make sure the area is safe. 2. Check for a response. Check consciousness and vital signs of response. As you approach them, introduce yourself and ask them questions to see if you can get a response. Kneel next to them and gently shake their shoulders, asking, "What has happened?" Open your eyes. If the casualty opened their eyes, or gives another gesture, they are responsive. If they do not respond to you in any way, they are unresponsive and they should be treated as quickly as possible. 3. Open airway. Open the airway by placing one hand on the forehead to tilt the head back and use 2 fingers from the other hand to lift the chin. If they are unconscious, you need to move on to breathing as quickly as possible. 4. Check for breathing. You need to check if the casualty is breathing normally. Place your ear above their mouth, looking down their body. Listen for sounds of breathing and see if you can feel their breath on your cheek. Watch to see if their chest moves. Do this for 10 seconds. 5. Check for circulation. Once you have established their breathing, look and check for any signs of severe bleeding. If they are bleeding severely, you will need to control the bleeding by applying pressure to the wound. 6. Treating the steps as needed. And 7. Call for emergency help.
Wonderful.
Well, we are going to end our lesson for today. We will continue with the principles of first aid next class. Any question?
No, sir. Thank you so much.
Okay then, see you next class. Thanks for watching. I am Abubakar Forna. If you like this video, please don't forget to like, comment and subscribe to my YouTube channel.